You know, it occupies a sizable portion of our bodies, one we generally don't pay attention to or even worry about until something goes wrong. Ladies, I'm talking about our bones. Get this, more than 10 million adults in the U.S. have osteoporosis, a staggering 8 million of those women. Joining us today in segment 1 of our 4-part series on osteoporosis is Susan Rawlins, a nurse practitioner, along with Dr. Sol Epstein, here to discuss this far too common health issue. Doctor, let me start with you. Let's talk about osteoporosis, what it is and what it can do to a woman when she's diagnosed with it.
I welcome this opportunity to talk about a disease which is not recognized, underdiagnosed, and undertreated. It's a disease that causes your bones to fracture. And this is caused by a number of factors, one of which is increase in age. In the woman, it is the loss of estrogen at the menopause. All this leads to a deterioration in the type of bone, the quality of the bone. The bone becomes thinner, it becomes fragile, it cannot withstand what we would call ordinary stresses, and boom, the bones break.
Now, Susan, give me like the big picture as it relates to osteoporosis.
Well, osteoporosis is a significant problem for men and women, but it's a much bigger problem for women. Of the people diagnosed with osteoporosis, 80% are women and 20% are men. So we women have to really be concerned with it. We have to get our health checkups so that they can find out whether we have osteoporosis or not.
Now, doctor, is genetics, diet, are those factors too?
I think it's a whole host of factors. But there's no doubt that genetics play an important role. There are other risk factors that women should be aware of. I think the menopause, I think if they've had a previous fracture, if they smoke, excess alcohol, family history, all of these factors make the patient prone to osteoporosis.
Now, Susan, when a woman comes in, and I'm sure you see them daily, and they're diagnosed with osteoporosis, what are their main concerns when they come and see you?
Loss of their freedom, loss of their independence. They're afraid of falling. And hip fractures are a significant problem when they fall. And many times it's what makes women move from independent living into assisted living facilities. And unfortunately, 30% of women will die within 12 months of having a hip fracture. So it is a significant problem.
And doctor, what kind of proactive measures can a woman take, including medication, to help either prevent or even treat osteoporosis?
Exercise, healthy diet, don't forget your calcium and vitamin D. And when you come to medications, there's a class of drugs called the bisphosphonates, of which alendronate sodium fosamax was and is the world leader. And there is a new formulation, an oral form of this, which helps patients who have problems taking pills. Patients are on a lot of pills for other diseases. And with this new medication, it is a effervescent form. It's a tablet. It's put into liquid. And this will ease some of the concerns with the patients who may have difficulty in swallowing, as well as those who don't like to take pills.
Can you show me how it works?
Yes, we have some BINOSTO, which is alendronate sodium, which has been used for many, many years. It's well known to take care of osteoporosis. And you just drop a tablet into 4 ounces of water. And the nice thing about this is a small volume to drink. Many women don't want to drink a big glass of water, which you have to if you take a pill to move the pill through your system. But with BINOSTO, it dissolves in just 4 ounces of water. You wait 5 minutes, and then you just drink the water.
And that's it?
And that's it. Now make sure you use tap water. Don't use any of the fancy mineral waters or anything. You want to use plain tap water. Drop your tablet in, wait 5 minutes, and you're good to go.
All right, so let's wait those 5 minutes, let the magic work there. We're gonna come back, talk some more about osteoporosis, and also when we come back, we're gonna be meeting one of the many faces of osteoporosis as we get up close and personal. The Balancing Act continues. Stay right there. Welcome back, everyone, to the first in our series on osteoporosis, a condition affecting millions of adults, mostly women. Joining us now is Kathy Poole, a woman who has been dealing with osteoporosis for the last 10 years. Thank you so much for joining us, Kathy.
Thank you.
Tell me what happened. How did you know you had osteoporosis? When were you diagnosed? What was going on?
It was a routine physical. My doctor gave me a bone density test and saw I had it and put me on osteoporosis medication.
Were you surprised?
Oh, yeah.
And did you realize how serious the condition can be and what it can do?
Yes, I did.
So what are you doing now to control it?
I am taking BINOSTO once a week, and I took a pill before once a week with 8 ounces of water, and it was really hard to drink 8 ounces of water first thing in the morning and this way, and take a pill, which I don't like to do that much. But BINOSTO was easy, and it tastes good, and it's quick.
Before the break, you put the little pill in. Talk to me again about how long it has to be there. She mentioned she has to take it once a week.
Yes, BINOSTO, you dissolve your effervescent tablet of alendronate sodium in the water, and it takes 5 minutes to get into complete solution, so you have to wait for it to quit the fizzing.
Okay.
And then you drink the 4 ounces of water, and you have your whole weekly dose of BINOSTO in the morning. Now you have to wait 30 minutes after you take it before you have any other food or drink, even coffee. You want to taste?
Doesn't matter that I don't have osteoporosis, right?
Oh, you're going to take a sip.
Oh, it's excellent.
Yeah,
it's excellent. I love it. Any advice you'd give out there to those women who maybe don't know if they have it and why they really, really need to get tested?
Be aware of the disease, seek professional help, get diagnosed with the technology, and following on that, go on to appropriate medication. And the other thing, which is very, very important, is you can't ignore it.
Thank you so much, all three of you. Dr. Kathy, Susan, I really appreciate the information and the awareness you're creating. Very
Thank you
important.
very much.
Thank you for your time.
Thank you.
Pleasure.
This has been the first segment in our 4-part series on osteoporosis, so stay tuned for future shows. In the meantime, if you'd like to find out more about today's very relevant health topic and the constructive actions we can take to help manage osteoporosis, visit BINOSTO.com. That's BINOSTO, BINOSTO.com. Or visit National Osteoporosis Foundation's website at NOF.org. And join us on Facebook for more on this vital topic. Just look for the Balancing Act.